Modifications to the HCBS Settings Rules. If you receive home and community-based services from the DSHS Developmental Disabilities Administration, you have rights under a federal rule called the HCBS Settings Rules that ensure you enjoy the same benefits of community life as people who don't receive services. If your service provider or anyone else wants to restrict any of these rights due to concerns about your health or safety, they can only do that if you agree and it's included in your person-centered service plan. An example of a health or safety concern would be a medical condition, like diabetes, where someone may be able to control their blood sugar with certain supports in place without limiting access to food. In that case, they would not need a modification. But if it got to a point where their blood sugar was out of control, they continually went to the hospital, etc., then they and their service provider could talk about next steps and whether it would make sense to ask for a modification that restricts the food they eat. Modifications must be individualized to your needs, just like with the diabetes example. They are not one size fits all. If you agree to limitations, your person-centered service plan must include a description of the concern, a description of your supports before any changes are made, attempts to meet your need that did not work out, ways to measure if new changes have been helpful, regular review to see if the changes are still needed, assurance that the new supports will not harm you, and your written consent. If you disagree with a restriction or plan modification, tell your DDA case manager you don't agree. It's enough to say no. You can do this by phone, email, or in person at their office. Your case manager must respond to you within 2 business days. You can also file a complaint at dshs.wa.gov/DDA. If your problem is not resolved or you do not feel heard, you can raise your complaint to a higher level by emailing DDA Headquarters Constituent Referrals at ddaconstituentreferrals@dshs.wa.gov. If you have a concern about abandonment, abuse, neglect, exploitation, or financial exploitation, call 1-866-END-HARM or 1-866-363-4276.